title, What is Jaundice? Causes, symptoms, and treatment. Assalamu alaikum. Today we'll talk about jaundice, a common health issue that affects the liver. Jaundice is not a disease itself, but a symptom that shows there might be a problem with your liver. In jaundice, the skin, the whites of the eyes, and urine turn yellow. Common symptoms of jaundice: yellowing of the skin and eyes, weakness and fatigue, loss of appetite, nausea or vomiting, dark-colored urine, abdominal pain, or discomfort. Causes of jaundice: hepatitis viruses A, B. C. Liver inflammation or damaged blood disorders, blockage in bile ducts. Alcohol or drug abuse. Treatment. Treatment depends on the underlying cause. If it's viral hepatitis, doctors recommend rest, light food, and medications. Drink plenty of clean water, avoid oily and heavy foods. Consult a doctor as soon as symptoms appear. Prevention tips: drink clean, safe water, maintain good hygiene, avoid contaminated blood or use needles. Get vaccinated, especially for hepatitis. Your health is your most precious asset. If you notice signs of jaundice, don't delay. Consult a doctor immediately. May you stay healthy and safe.